I don't know who you are, but you're not gonna ask any bad questions, are you?
Good morning and welcome to our COVID-19 update. I hope that when we suspended these meetings at the end of spring, that we'd be done with this chapter in our history forever. Unfortunately, our cases have been steadily increasing again. So today, here we are to talk about how we can all do our part to stop this trend. I'm thankful to have with us Decatur Morgan Hospital President Kelly Powers. Kelly, thank you for joining us today. And then we have again Alabama Department of Public Health Administrator for the Northern District, Judy Smith. Judy, it's good to see you, but not under these circumstances. Okay, good to have you with us.
Thank you, sir.
So here's where we are. As of today, we have 12,459 confirmed cases and another 2,482 probable cases in Morgan County, bringing us to right just short of 15,000 cases. And that may not sound like a lot, but our cases are increasing, and we know how quickly that can become exponential. Approximately 37,761 individuals have completed their vaccine series in Morgan County, and for that we're very thankful. So with that, Kelly, can you give us an update from the hospital, please?
I will. I'll tell you, this morning we have 7 inpatients and 1 presumptive under investigation, so that brings us to a total of 8. And Mayor, I think on Friday we had 5, but we were down the week before to 1, 2, or even zeros at some point.
So and at that Friday, had that been sustained for like a month or
no, maybe a week
of those low numbers?
We had low numbers, and then we started about a week and a half to 2 weeks ago with 2, 3, 4, 5, 8. Now we're at 8, so we're continuously seeing the increase.
Yeah, thank you.
Okay.
I guess what I'm asking, that those low numbers, how long were they in place?
Yeah, probably a couple of months.
Okay.
I would say 2 or 3 months. Yeah.
Thank you.
It was down. Like I said, we were so thankful when we had none. So we were at 0, off and on. Every once in a while somebody would pop up with it, but now we're seeing a constant increase in the patients, and the average age is 58. So again, we've had an 18-year-old, 31, 45, trying to think through, a lot of younger population in the hospital.
Okay.
And most of them are non-vaccinated people. So I'm here today, I guess, to beg and plead with people to please get the vaccine. I'll share with you, our clinic is still open on the Parkway campus. It is open from 8 to 3. Starting August the 1st, it's going to be 8 to 3 Monday through Thursday. We do walk-ins, but we would prefer if people would call ahead just for an appointment, and it's 973-2888. That's 973-2888. Or you can go to DecaturMorganHospital.net and register online. It is on the Parkway campus, and we have plenty of vaccines.
Very good, and we certainly hope our residents will take advantage of that.
Me too.
Thank you. Thank you. Ms. Judy?
Well, Mayor, I have to reiterate what you said. We had hoped we had closed the book on this, or at least gotten very close to the last chapter. And unfortunately, that's not where we are. Were we a little tired of being here? Yeah. Were they probably tired of seeing us? Probably more so than we were tired of seeing them. So, it's really hard at this point to know exactly what to say, because I think we've said it so much that to some extent it's kind of falling on. We're tired of it. It's deaf ears. We're kind of sick of hearing it. But Mayor, as you've said, we're going back in the wrong direction. And I, to some extent, sort of feel like the Olympic folks that have tried and tried and tried, and they've almost made it to the finish line, and then something grabs it and takes it out of their reach. And, what you've worked for all this time, is just not where it should be, where you wanted it to be and where it is. And I guess if I would start and end today, and I'm going to do this on behalf of myself and the hospital without permission, and say, my message to you all is we're going to do everything we can to be here for you. We're going to stay the course. We're going to run the race, and we're going to do whatever we can to be with you. On either side of this table, you're looking at the continuum of healthcare in Morgan County and in North Alabama. on my side as a representative of the Department of Public Health, you know, our goal is to promote, protect, and improve Alabama's health. And I truly believe that's what we have tried to do in the course of this. One of the things that certainly we did from the get-go was do testing, try to do quarantine, to try to do things to separate people. And, you know, and then at some point, Kelly and her team at the hospital picked it up. They continued the things that we were doing, but then they also were providing a monumental care for folks that just didn't make it, you know, past that point. You know, back in November and December, we literally thought the healthcare system was going to blow up. And we said if we could just hang on, until we got a vaccine, you know, everything's going to be all right. We were singing, was it Merle Haggard, you know, that we were singing with, if we can make it through December, you know, and we were really, you know, getting there. And one of the things that happened is we did get the vaccine. And quite honestly, it proved that it would work. You know, we got the vaccine. Actually, people were knocking the doors down. People were tripping over each other, getting mad at us because we learned to redefine what essential meant. And we you know, tried to keep at it. And then all of a sudden, it just kind of bottomed out. People decided it was over. You know, we got back together socially, which is a great thing, you know, but at the same time, folks decided that, well, you know, it's kind of over. I'm not going to get the vaccine. As Kaylee has said, you know, I think at Decatur Morgan Hospital, 84% of the people that are in the hospital are unvaccinated folks. Across the state, 92% of the folks that are in the hospital are unvaccinated people. Nationwide, we are reporting, and I'm sure that Alabama's is somewhat like this, the data's still being analyzed, but 99% of the folks that are dying are unvaccinated folks. And I want to talk a little bit, well, first of all, I've talked about the numbers. You all have heard them on the news and you know, ad nauseum, and you probably don't want to hear them anymore. I will say that in the last 2 weeks, we've had an additional 166 people in this county that have been diagnosed with COVID. Kelly talked to you a little bit about what the hospital here has, but let me also tell you, this county uses the Huntsville hospital system, and between Decatur Morgan and the Huntsville hospital system, we went from like 40 to 45, and over the weekend where we usually send folks home, we now have, well, I don't have Kelly's 2 additional people adding, but we have like 52 people in the hospital. And of all those people, probably 25% of them, 1 in every 4 is in ICU. Some of those people are on vents. I want to go back and say, first of all, we will be here for you. I want you to know I took the vaccine. My family took the vaccine. I'm selfish. I care about myself. I care about my family. And quite honestly, as a public health provider, I care about you. That's why we keep on keeping on to try to get this message out to the folks that we want to get this message. And as Kelly said, we're going to be here for you. If you change your mind, you know, we're not going to try to shame you. We're not going to whatever. We're going to try to protect you. We're going to try to promote your health. We're going to try to offer to you what I felt like was good enough for my family. And let me also say that there is a high probability, particularly because of the variants, it's not defined yet, that there will be a recommendation for boosters. I will be the first one in line. I'm selfish. I want to live. I don't want to be in Kelly's hospital except as a visitor. And, you know, I want to take care of me, but I also want to take care of you. The other thing I want to say is that Kelly and I are not going to go home. Our teams are not going to go home until everybody goes home. Until we do what we're about, we're not going to give up on this. We're not going to quit. You all are sick of us saying, wear a mask, stay apart, wash your hands. The other thing I'm going to say to you is don't go to work sick. Please don't go to work sick. Yes, first of all, the vaccine does work. I want to mention a couple of things about it. You hear on the news all the time about the breakthrough cases. We've had a little over 2,000 breakthrough cases in Alabama, but that's out of 1.5 million folks that have been vaccinated. Now keep in mind, we've got 5 million folks in this state, but that's still not enough folks vaccinated. But we do have breakthrough cases. Nobody ever said that the vaccine was 100% effective. Nobody ever said that. The goal of a vaccine is to protect you. And if it doesn't keep you from having disease, it decreases the severity of that disease and it keeps you out of the hospital. And quite honestly, even for the folks that have been the breakthroughs, that's what we have seen. The vast majority of them did not end up in the hospital, and they did not end up, having serious illness. They had like a cold or whatever. If I can have a cold or cold-like symptoms and stay out of the hospital, that's a winner for me. I feel like I'm a winner in this game. The other thing I want to say about the breakthroughs is that a lot of these folks have been folks that had immune suppressed situations. There are people that were on cancer chemo. There are people that were on suppression because of transplants or because of rheumatoid arthritis or because of other things that were going on. And they had some protection, but they didn't have as much as we would like for them to have. Now, let me say that when we give this vaccine to immune suppressed people, one of the things they are told is you may not get the same level of immune response that other folks get. So you still need to be careful. So this is one of the messages that we have out there. The other thing that we have going on is we do have a lot of reinfections. These are people who had COVID, got past it, they now have it again, or have had it again. And so they're going around this same situation again. Some of them are a lot sicker than they were the first go around. And our goal in public health and then my hospital team is to keep you out of trouble. And it's a heck of a lot easier to stay out of trouble than it is to get out of it once you get in it. And again, that's the message. That's where we are. We have extremely low vaccine rates. In Morgan County, 36% of this population, eligible population, has had one dose. Folks, that's not enough. If you read all the research whatsoever, one dose is not enough. We have 31% of the population that has had both doses. Now, keep in mind that everywhere you go, 70%, 69% if we're going to be accurate, have not been vaccinated, are not protected, and have the potential to pick up and spread that virus. Are we going to end up back in masks? Right now, it's an option you can use anyway. Once again, we need to do the things that we can do to protect ourselves and protect our families. I'm going to do what it takes to protect my family. I hope you will consider the same thing, and I hope that you will understand we're not offering you or doing anything for you that I wouldn't do for my own family, that I'm not going to do for my own family. If I am in a crowd, if I am in a situation where I know that 70% of the folks that are there potentially are not vaccinated, potentially could have COVID, am I going to wear a mask? Yes, I am. And I'm going to be proud to do it, and if people want to snub me, then that's their prerogative to do so. So once again, and I know the mayor would like for me to end this,
take your time.
wear a mask, stay apart, or wear a mask when you think you need to wear a mask. Stay apart as much as you can, and yes, Uncle Joe is still not invited to the Thanksgiving, to the whatever's fixing to come up. Listen, I'm still hearing about this inviting Uncle Joe several months ago. And wash your hands. Don't go to work sick. And please, please consider the vaccination. I've been in public health a long time, and I choose not to tell you how long that has been. And during the course of my tenure with public health, I've seen vaccinations of all types. I've seen us give measles, mumps, and rubella to kids and keep them from having meningitis or keep them from having, numerous diseases. I've seen such an impact that vaccines have made on the quality of care for our community, for our families, for our schools, for everybody. So please just consider vaccinations. I would not recommend to you anything that I would not recommend to my family. I also would not, as a public health provider, steal something from my family, the vaccinations, the whatever, that I would not also steal for you, that steal on behalf of this community. I will mention that the two biggest reasons we see people getting vaccine right now, and it is up some, not enough, but it is up some, but the first one is fear. Maybe a healthy dose of fear. People say we spend a lot of time scaring people. If scaring you protects you, if being afraid to jump off the cliff or go over Niagara Falls in a barrel, is enough to keep you from doing it, then heck, I think you need to do it. You know, and the second reason is to get to do something. And I'll be very honest with you. You know, my adult children got vaccinated without any pause whatsoever because, first of all, they didn't want to be around me because I work in public health. But, you know, for all the right reasons. My 18-year-old grandson decided he wasn't going to be vaccinated. You know, when you're 18, you know everything and the world's great. Then he found out he could not go to college if he was not vaccinated. So a lot of folks are getting vaccinated so they can go to camp, so they can go. Even if it's not the best reason I would pick, if it gets you where you need to be safe, I can live with that. Keep in mind, once again, we are the continuum of healthcare up here. Kelly and I and our teams, not just she and I, but our teams are in it for the long haul. Again, we're not going to go home until everybody gets to go home. We're not going to quit as long as we need to stay at what we need to do. We would prefer that you not be in the hospital. We would prefer that you be vaccinated. But we will do what we need to do to promote and protect the health of this community. Thank you, Mayor, for the opportunity to be here.
Thank you, Judy. Thank you for your communication skills. So with us today, we have Nolan Crane with Channel 48, Lauren Harkston with Channel 19, and then Matt has joined us with Way 31. Nolan, do you have any questions?
Yeah, the first question, school starts in a couple of weeks. Do we have some statistics as to how many of those eligible students, be it middle school or high school, have been vaccinated? And are there concerns with school starting back up and you have class sizes of 20 to 30? Masks are required, they're maybe recommended, not required. There's maybe some people still on the fence as to what is the protocol. But do you have some statistics, and what's your message to parents of those school students who are eligible but have not yet been vaccinated?
Well, I guess I'll take that. Well, first of all, we have a number of students that are not eligible yet. You know, the studies are still going on. Our hope is that soon the eligibility will be lowered, the age groups will be lowered, that we'll be able to get the vaccine. One of the handicaps we have right now is the only vaccine that has been approved is the Pfizer vaccine. And Kelly and her team offers the Pfizer vaccine from the 12 to 17-year-olds. Please take advantage of it. You know, the Moderna vaccine at this point is still under review. That's the one the health department has. And again, we're hoping soon. Let me add to the comment about Kelly in the hospital. Some of the local pharmacies, such as Payless and some of the others, also have the Pfizer vaccine. And you can look on the COVID webpage on the Department of Public Health, the vaccine finder, and find out exactly who has the vaccine. Now, we are still a week to 2 weeks, and as we've learned in this thing, our mission doesn't change, but our plans change. Sometimes every day. So what I tell you today may be totally different next week or week after next. I think what you're going to see is a high recommendation for masks in schools. I don't think you're going to see a mandate. I know that there is a true effort to avoid that. So many people were just, you know, that became a real barrier to cooperation because people felt like government was mandating stuff. But I'm going to quote something that I heard somewhere else. You know, it really doesn't matter who's in the White House or the State House. What's important is what's going on in our house. And if wearing a mask is what we need to do to protect our children, then let's do it. I do believe that what's going to happen is that the mask will be recommended. They may be required in some situations. I think we all, those of us who have enjoyed the Olympics, you know, have found out they've gotten in trouble over not masking and not vaccinating. We've lost players that trained all of their lives to be in the Olympics and then couldn't do so because they either tested positive for COVID or they were in a quarantine group. So what I think is going to happen, you know, the schools have been monumental in putting up plexiglass and doing sanitation and doing all the things. Schools want children back in school. Children need to be back in schools. And I believe that they will do everything they can to protect our children. Parents and families are going to have to cooperate with the schools. And you want your children to wear masks, I think you're probably going to see extra masks available at schools for children to wear. So again, it's not about other people's houses, it's about your own. And I think you'll see the schools protecting the children.
Do you have any statistics as to how many have been vaccinated or not?
You know, I don't have them with me. I have to be honest, I don't have them with me. Unfortunately, the least vaccinated group is the under 25 group. And I told you about my 18-year-old grandson. You know, I have to yet, I've worked in public health again a long time, I have to yet to see 15, 16, 17-year-olds just get so excited about getting to take a shot. And, you know, it takes a little parental encouragement, but if they can't do some of the things they want to do, whether it's camp or whether it's basketball or whether it's whatever, you know, I think that's an encouragement within itself, so.
I wanted to add to that though, one thing. I think that the thing I'm seeing on the hospital side is the 40, 50, and 60-year-old people, and I don't really understand why they're not getting the vaccine. And as we get into the school year, you'll start seeing, you know, football and all these other activities that I'm sure all the grandparents want to go to. This Delta variant is highly contagious compared to what we saw before. So, you know, going into those events, and it might not just be sports, but other events, we want these grandparents to get to go, but I'd love for them to be vaccinated so they don't end up in my hospital or, you know, in the morgue. The other thing I think we're seeing across the nation where they're 2 to 4 weeks ahead of us is with the other time when we had so many deaths. Most of those people had either some health conditions, but we're seeing now that that's not the case, that this is so contagious that people can get so sick very rapidly, where their oxygen saturation might be 70, and we can't recover them. That's what I'm seeing in Missouri and some of the other states. So I think people need to really take this seriously. You know, if you're 40, 50, and 60, and you haven't had the vaccine, you know, even in your 70s, please get the vaccine so that you're not the one spreading it at these events. Thank you.
And if Kelly and I can tag team off of each other, you know, one of the things we also failed to mention, and I'm bad about not mentioning it too, is not just the deaths, but it's what's known as the long haulers. There are a lot of people, probably a third of all people who have had COVID that still have aftermaths of that. You know, it's so significant that UAB is even starting clinics to study, you know, what the long haulers are and what they can do about it. You know, chronic fatigue seems to be one of them. I just don't have the energy. I just can't do the things I did before. You know, there's a couple of folks actually in my church that have cardiac conditions that are continuing since they have COVID. You know, brain fog is another one. That is one you hear about a lot of times. And I will tell you that I was actually in one of, not Morgan County Health Department, but one of my other health departments recently. And we had an employee who was unvaccinated, who had COVID, who was now back to work. And her coworkers were mentioning me, I'm telling you, Judy, she repeats herself all the time. I'm telling you, I'm concerned about this. So it's not just being a little bit sick. It's not just even being in the hospital and getting to go home. But it's we don't know what the long-range effects of this are going to be. We just simply do not know. Again, is it worth staying out of trouble? I also failed to mention our clinic, and Kelly, I truly appreciate the fact that you all have been so dynamic in terms of making the vaccines available. The health department is offering the Moderna vaccine, which is 18 years of age and older. All those, you take care of those children, send all those other folks over to me. Every day, Monday through Friday, 8 to 5. Now, you do not have to have an appointment. It is a walk-in clinic. I would suggest that you call because we also have a serious uptake in people being tested. And what we really don't want you to have to do is we don't want you to have to wait. We simply don't want you to have to wait. We want you to be able to come in, get your shot, come back and see us in 4 weeks and tell us you didn't have a bit of trouble. If you did have a little bit of trouble from that vaccine, 1 day, 6 hours, 12 hours of not feeling so hot is a heck of a lot better than a hospital 2 or 3 months or a forever from situations that we simply can't define at this point. So again, we're there for you on both sides of this healthcare continuum. Just let us be there for you.
Very good. Lauren Harkson with Channel 19, any questions?
We do not.
Do you mind repeating the question so our viewers can make sure they heard the question, please?
Sure. So we've been talking about COVID
You'll need
numbers
to.
rising all morning, but do we know how many are COVID variants like Delta?
Her question is, do we know how many of the increase are from the Delta variant? And we do not. We randomly check that to know that it's in the state. It's a send-off test from the hospital, so we do not know exactly how many are the variant.
We do know at this point, as of Friday, and I don't have new numbers for today, that there were 200 defined Delta variants. Now, that being said, there's about 1,700 of the total variant, different types of variants, but about 200 of those are from the Delta, and it's pretty much scattered throughout the state, so there's some of it everywhere. Now, I think Kelly made a very important statement, and that's the random testing. You know, we only know from those that have been tested that have had the sequencing done, so those are clearly very, very low numbers. And let me just mention, variants are being classified right now in 3 different categories. There's variants, the variant, and it ends with a T, but it's a variant of interest, a variant of concern, and a variant of high consequence. Right now, all of the variants that we have are considered of concern. At some point, will something be moved to those of high consequence? That is certainly a probability. So, but if you already have a weakened system, you already have then certainly, you know, there is danger there. Some of the breakthroughs have believed to be the variant, the Delta variant. But again, I repeat, those people that are vaccinated tend to have much milder diseases. They tend to stay out of the hospital. It's worth it. It's worth it to be protected.
Thank you, Judy. Lauren, any other questions?
Yeah, so I know Nolan spoke a little bit on students going back to school. So do we expect there to be a spike in the next month when students go back?
Spike, is that what she said? Yeah. Do we expect a spike? And I mean, just looking at other states, I would have to say yes. And the fact that we're seeing, you know, the numbers rise, you know, we added from Friday from 5 to 8, so that's 3 in 2 days. Huntsville added 5 over the weekend, Madison added 4. So yes, we're seeing more and more. So I think we'll continue with that spike as this Delta variant, you know, comes in our state.
And additionally, as the vaccine rates are less,
Yes.
you know, the potential is certainly there. But you know, one of the things that I think we have to concentrate on is, you know, and obviously we have to know what the problem is, but it's somewhat less about the problem. We know what the problem is. What do we do to fix it? And what the number one thing that we know right now we can do to fix it is to increase our vaccination rates. I will mention, and y'all always love my little analogies, but you know, I've been working on the grass at my house, and I will tell you that if you don't kill the weeds, you'll have all these little foreign weeds that come up through the cracks, through everything else. That's where we are right now. If we don't kill this virus, if we don't do a monumental job of getting rid of the virus, we're going to continue to have all these little variants that come up. And will we ultimately end up with ongoing vaccinations because of this? Probably. We may end up with it anyway, but it's a small price to pay to keep our community safe.
Thank you, Judy. Lauren, I want to add that just from what I saw last year, and I certainly do not represent the Decatur City school system. They are totally separate in the way that they're managed from the city of Decatur. But they seem to take a very conservative approach to how they managed in-person instruction, and did a lot of virtual learning and things of that nature. I know that that is not their preferred method of educating our children, but to be safe and to try to avoid the spread of the virus and sickness, I would think that's probably what they will end up doing should this worsen. Not that they're making plans to do that. I want to be clear in saying that. Lauren, any additional questions?
Yes, I have one more. So, as most of us know, last week Governor Ivey blamed the rise in numbers on those who aren't vaccinated
I don't have any comments on Governor Ivey's statements.
I think that's what we're doing here today, Lauren, is trying to, plead with our community to say, please come get vaccinated. We have it, as I mentioned earlier, Judy has it, we all work together, do a great job with the health department to tag team this, and we also have our mobile medical unit, and if there's any companies out there that would like for us to come, churches, anything like that, we are always open to go on the road and try to get as many people vaccinated as possible. So I think that's our message today is please get vaccinated.
And our additional message is, when what you're about, when public health, when I said earlier, when what you're about is promoting, protecting the public, for getting us back to some level of normal, for getting us to where we all want to be, all of us at times say things that literally emphasize our frustration. Do we get discouraged in public health? Yeah, we do. Do we get a little frustrated that people, say that we're just trying to scare them and that we're whatever? Again, I'm not doing anything for you. I'm not saying anything to you that I have not said to my own family, that I have not tried to do for my own family. So, I just want to share the love, share the protection, share the whatever. So, but do we all get discouraged at times? But as long as there's those of us who believe in the cause, we're not going to give up the cause. And as long as there are those of us who continue to put forth for the cause, there is hope that we'll get past this. And if it takes a little voicing frustration, then I'm not going to condemn either side. I'm just going to say that Kelly, the hospital, the public health system, your local pharmacies, your healthcare providers, we're going to be there for you and with you as far as we can possibly go.
For those that have taken the vaccine, we're so appreciative, myself included, my wife, family. For those who haven't, seem pretty firm in that position. We hope today that maybe the time that we spent may change that in some way. So we want to thank you for joining us. We will keep you posted on updates. In the meantime, if you want to get vaccinated, you can go to vaccinefinder.org to help you locate one of the many vaccine locations in our community. Vaccine it if you can, and remember to practice good health hygiene. Be safe and be kind, Decatur. Thank you.